Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi, Dr. Darrow. How are you?
I'm living it up, Nita. You make me laugh just hearing your beautiful voice and thinking about you.
Thank you. You make me laugh, too, because I have actually a funny thing to tell you sometime during the hour, actually.
All right.
So it's not a joke. You don't have to answer. It's just something funny to tell you. So
do you know this morning, Michelle, my wife, told me to stop impersonating a flamingo. So you know what I did? I had to put my foot down. And then later, I went to buy some camo pants, but I couldn't find any.
Well, because they were hiding.
Nita, you're supposed to be laughing, not talking.
Okay. That's pretty funny. So
Did you know I failed math so many times at school? I can't even count.
Okay, that I don't believe about you. You're too smart to fail math.
Yeah, but then I used to have a handle on life, but then it broke.
Yeah, right. That I believe. So I won't be doing any breathing during this hour.
Okay.
I did all my breathing prior to the show.
Okay.
And thank God for Alex. He reminded me, breathe now, not later.
Right. That's right. We love Alex.
We do.
Should I get some questions? Should we give out the phone number? Let's give out the phone number.
Oh, good idea.
Because we're talking about how to heal your musculoskeletal pain, all of your orthopedic stuff, ways that you can avoid getting a surgery that you probably don't need. And all you folks who know me, who listen to me, I've been doing this show for over 20 years, and I've been practicing orthopedic medicine using regenerative medicine, which are injections of, now they're platelets, PRP, that's platelet-rich plasma and stem cells, to regrow tissue and avoid putting a knife in your body to cut tissue out, which is needed sometimes. I'm not putting down surgery, because there is no question surgery is the toughest part of medicine. A lot of us guys in med school or in girls wanted to become orthopedic surgeons and didn't get there because it's a hard road to travel. Unfortunately, there's too many orthopedic surgeries being done today. And when I say too many for the wrong reasons, things like meniscal tears, rotator cuff tears, labral tears, a lot of arthritis and things like that. I see people coming. As a matter of fact, I had 2 different people yesterday saying they needed a knee replacement and didn't really need it at all. I have that all the time where people come in and they're all forlorn and nervous and feeling terrible, saying my surgeon told me I need to have surgery. And then when I do an examination, I tell them I don't think they need to. They, of course, can do it if they want to, but the risks are high, and I've seen some bad results when I was in my training. I'm going to give out the phone number now, so grab your pens and pencils. I would love to talk to you, and that way I don't have to tell terrible jokes and make Nita feel bad. So the phone number
I don't
to
feel
the
bad. It's all good.
Oh, good. You're in a good mood. I like that. So if you want to call me right now, you can write this down. It's 866-870-5752. 866-870-5752. And if you're shy, which I hope you're not, give a fake name. Pretend it's your father or your sister or your son or a friend or something like that. And you can always call my office if you want to get more information than we talk about on the show. And the number to the office is 800-300-9300. That's 800-300-9300. If no one picks up, just leave your phone number. We'll get right back to you. And if you want to watch these procedures of regenerative medicine, stem cells and PRP or platelet-rich plasma, just go to the website, which is www.lastemcells.com, www.lastemcells.com. And on every page there's a spot where you can email me if you have questions or things that are more personal that you don't want to talk about. My preference is you call now, though, and talk to me, and we will take good care of you, answer all of your orthopedic questions. And the phone number to talk live right now is 866-870-5752, 866-870-5752. So, Nita, you promised you weren't going to breathe, but we hear you breathing and scrambling around.
Well, I just like to have everything ready for the first caller.
I know you
So
do.
I am waiting for the first caller.
All right.
So perhaps you need to say the phone number again and also the website.
Okay. Yeah, some people are driving and they have to pull over to write this down. The phone number to talk to us right now is 866-870-5752. And the website, if you're by your computer, is www.lastemcells.com. You can email me from each page, and you can watch videos of me injecting the body. Nita, you're crinkling so much today. How come? You're a crinkler.
It's my clothes. I instead of wearing
You're
cloth clothes,
polyester.
I'm wearing paper. Everything I sewed it myself. Everything I have on, my scarf, my sweater, my pant, everything's made from paper.
Wow.
So every time I move in the chair, you hear a crinkle. See, you hear this.
That's what I hear. Exactly. I'm going to go to a question right now.
Okay.
I get questions all day and all night, and people email me constantly. First thing I do when I wake up, I answer emails. At breaks between patients, I answer emails. At night before I go to sleep, guess what I do?
Answer emails.
I do. I love it.
I got that one right. I get points.
You get 100 on every
Oh,
test.
boy.
All right, let's go to this one. It says failed meniscus and calf is tight. Well, let's see what they say. I had meniscus surgery in my left knee 3 months ago and still have significant pain in the meniscus area. I don't know if they know what the meniscus area is, but that is the cushion between the tibia bone, the lower leg bone, and the femur, the upper leg bone. And it's like a pancake in there that cushions the bones. The bones have cartilage on top of them, and then they slide on the meniscus. So after the surgery and my 2-week follow-up, it was noted that my left calf was very tight. To this day, it is still tight and feels like it's in a constant cramp mode with the loss of strength and loss of muscle. Whoa. I'm 67 years old, very active, play pickleball. I'm a golfer. I want to remain active, looking for help. Thank you. So this could be a problem. This could be what we call a compartment syndrome. And you can look that up, compartment syndrome. And as I always tell on the radio, go to Google, and if you have something anatomical you want to look at, just type in what it is. Let's say meniscal tear, compartment syndrome, rotator cuff tear, herniated disc, any of those words. And then on the upper left, there's a little spot that says images. And you click on that, and lo and behold, you'll see pictures and drawings of what these things are like, so you can see if you're accurate in terms of what is going on. So sometimes people will get a compartment syndrome in the calf or in the thigh. It could be in the arm or leg. I've seen it, or the arm or the upper arm or lower arm. And what this is it often is bleeding inside or inflammation inside of the fascia, which is a covering over the muscles. And if that is significant, you can actually lose the muscle. It can necrose or die. So I hope you are listening to this right now, this person that emailed me, because you need to go to the ER. Yeah, I don't like to tell people that. Most likely it is not a compartment syndrome, but they do happen after surgeries. So that's what I have to tell you, because I can't examine it to see. It may just be that it's trauma from the surgery. So a lot of people get a surgery, they're told they're going to come out great, and then there's some kind of side effect. I've seen them all. And one of them can be a tight calf. They can get banged up during surgery. Oftentimes, if people are getting a knee replacement, the perineal nerve will be tweaked and they can have a foot drop after that. There's just so many things that can happen that, to be honest, I'm not a proponent of surgery unless it's an emergency, and I'm not sure what emergency means, because to me it means something different than to other people. So there is a range of what emergency means. I've had a lot of people that I've talked to say, I've got an emergency situation, I have them get into the office quick, and it's not an emergency at all, but they get afraid, so we take care of whatever that problem is. There are a few cases like this one where I actually tell people, go to the ER. You know, if your leg is dead, go to the ER. You could have a syndrome where the spinal cord is smashed or something like that, and you need to have a quick surgical release to save your legs. There's just so many things. Being on the radio with people calling in and the emails I get, I often can't answer the question, but I am going to answer Dennis's question, because Dennis just called in. Dennis from West LA, you have a question about a rotator. Hang in with me. You have a question about a rotator cuff, and we're looking for other callers now, so get right behind Dennis here, who we're going to talk to in a second. And the phone number to talk to me live is 866-870-5752. So, Dennis, what's up with the rotator cuff?
Well, let me tell you, it's a bit of a long story. I'll try to make it short. I've gone through, I tore one once, and jogging and looking at a girl going the other way, tripped and caught myself and tore the right one. Okay. That got fixed.
Okay.
Then about 2 years ago, I found out I had prostate cancer.
Okay.
So they treated me with whatchamacallit. I got
Lupron?
Radiation.
Oh, you got radiation?
Radiation and butyrone acetate and something else.
Okay.
And then they gave me the hormone treatment.
Yes. Well, the hormone treatment, what it does, it lowers your testosterone. And when that happens...
Well, it's not lowering mine. Mine's still at 6, and it's been there since the inception. But
well, your PSA is 6, but your... Dennis, you got to listen, too. Dennis, we got a partnership here. You tell me stuff, then I respond, okay? So when you have the hormone treatment, your testosterone is lowered, but you're saying your PSA did not go down. It's still at 6.
No, my PSA is 0.01, undetectable. Doesn't mean
Wonderful.
I don't have it, but undetectable.
Good.
But she told me, this is the first time I ever heard about the testosterone. I just took my blood last Thursday, last Thursday, and I got the results on Friday, yesterday.
Okay.
And so, she told me that I've been a 6 since the inception on my testosterone.
I don't think that number is right, but it could be referring to something different. Testosterone usually runs. How old are you, Dennis?
I'll be 68 in January.
Okay, so your total testosterone is probably in the 400s or so at that age, and
oh, really?
Well, there's different lab values.
Good when you have prostate cancer.
Well, it doesn't matter if your PSA is down to nothing. They may have taken out.
Well, who my doctor is. You probably know my doctor, Holden. He's up at UCLA.
No, I don't do prostate work. I do musculoskeletal orthopedic work.
I know that, but I just figured you guys all maybe hang out together,
Did you have a question about how this relates to your rotator cuff?
I've fallen a couple of times. I've noticed since I've been taking the whatever the treatment has been, I've lost my muscle. I've lost my strength. And
well, that's the hormone treatment. Twice. You got to find out if you can get back on testosterone. Because if the
that's what I've been asking. I'm going on Monday.
Yeah, because you might be able to get back on testosterone and rebuild your body again. Anyway, how does that relate to your rotator cuff tear? I want to know that.
Well, I think because I've fallen a couple of times, and I retore the right one.
Okay.
10 years ago, 15 years ago.
Sure.
And the other one's torn so bad they wanted to put a fake one in.
Okay.
And
I would have to examine you. Okay. Most people with torn rotator cuffs heal with my treatment, and I'm one of them who did. I injected my own shoulder I have 2 rotator cuff tears and a labral tear on my right shoulder, but I don't have any pain because I've injected them both with platelets, both my shoulders with platelets and stem cells. So I'm fine.
Well, I'm gonna come
So-
and see you. I got
All
to
right.
go your other number down. I live in
Okay.
Westwood, almost.
Oh, wonderful. Yeah. Yeah, you're right around the corner. My office is at Wilshire and Barrington, just across from UCLA, across the 405.
Yeah. I'm by Pico and Overland,
Wonderful. I'd love to see you.
Century City.
Yeah,
right
and the
now.
number to the office again for those that don't have it is 800-300-9300. I'm not a proponent of surgery. You already had one on that right shoulder and it tore. I already had one on my right shoulder, and it made it worse. So, I'm just putting it out there. I love orthopedic surgeons, but I don't like a lot of the surgeries they do. For the tough stuff, I think they're
God
needed.
bless you.
God bless you
God
too,
bless
man.
you.
Thank you.
Thank you for your call.
All right, we're going to go to a different Dennis in Diamond Bar, and he's got hip issues. Dennis, how are you today?
Good morning. Doing good. Hey, question on the hip.
Yep.
If I can't point to the pain,
Yep.
is that sort of a deal breaker?
No. What else?
And it doesn't hurt all the time, but there are certain ways that maybe I walk or put pressure on it, and I'm getting it more regular.
Okay. So I love your question because it's one that everybody wants answers to, and it's very complex. Unless I touch the area, then I can tell you in about 2 seconds what's going on. But generally, when people say hip, they're not referring to the hip itself. They're referring to a generalized area around their groin all the way back to their buttocks. And for different people, it's a different area, but they use the term hip. So it could be the hip joint, and we can tell that by range of motion and by the way it feels and sounds in examination. It could be the side of the hip, which is called the greater trochanter, and there's 14 attachments to that, muscle attachments, tendons. So that one needs to be touched to find out. And then some people call the top of the buttocks their hip. They put their hand back there and go, my hip hurts. And I go, well, it's not your hip. That's your gluteus medius muscle or something like that, or your piriformis. So I need to touch the body to examine people. I get MRIs all the time and x-rays through email with people saying, please look at this and tell me if you can help me. And I can't by the x-ray or the MRI, although I like to get them and see them. I found a few cancers and things like that by looking at them. But we have to touch the body. And unfortunately, a lot of people with failed surgeries, I get that all the time. People come and say, I had a rotator cuff surgery, a meniscal tear surgery, or I had something else happen and I came out worse. And the reason for that is the surgeon didn't touch the body. I say, did the surgeon examine you? And they go, well, not really. They just put the x-ray or MRI up on the light box.
So are there things that I can do to prepare before I see you? Like, should I go to my general physician, ask for x-rays and MRIs, and bring that material to you? Or have you included on the results?
You don't need to do anything to come see me. You just come on in and we'll figure it out.
Okay. Thank you very much.
Yeah, I mean, I think if we need to get something, we'll send you down the street and get it done. But it's usually not necessary. Sometimes it is. I like to have all the information I can get, so sometimes that's important, sometimes it's not. Typically, if someone has an issue and I can find where the pain's being generated from and they don't have an image, I will inject them right on the spot. You don't have to come back. We just do the examination and then the injection right there. And if they don't heal right away, then I might get an image anyway to see what's going on because I may have missed something. But generally, I can figure out where to treat based on my hands touching the area and moving the person around, called an examination. And unfortunately, many people who have a surgery, when I ask them if the surgeon touched them, they say no. They didn't examine me. They just looked at the MRI and told me that I needed surgery. And I see that every single day of my career, which is a sad case because when you have a failed surgery, that's a problem. That's a real problem. You had a big surgery for nothing. And then the question is, do you get...
I'm not entertaining any kind of surgery. I mean, that's out.
All right.
But,
God bless you, Dennis. I appreciate
will call
that.
the office, make the appointment, and
Okay.
I know where you're at. I've been to see you with my knee. My knee's doing great.
Oh, good.
And so now it's moving on up a little bit.
Okay.
And,
so did I work on your knee, Dennis, at some point?
You, yeah. Well, yes.
Okay.
You examined and advised.
And it what?
And it's fine. You examined it and
Okay.
and advised me, and it's fine.
Okay, so it just healed on its own then.
Pretty much, yeah.
All right.
Over
Well, that's
time,
the way that's the way I like the body to be. Let it heal on its own. Stay away from doctors.
Right. Except you.
No, if you can heal on your own, that's the best. Be conservative. I like conservative measures because they don't hurt people. And what I do is very conservative also. It's just injections. But if you can heal on your own, that's number one. There's too many things that happen to people.
We will see you soon.
All right, Dennis, God bless. There's too many things that happen to people from surgeries and medications and things like that I'm very wary of doing any of that. Sometimes you need to do it, and I'm all for it when it has to be done, but it's being done way too much. People come in, they're so medicated, and I ask them why they're taking their medicines. A lot of them don't even know why. They go, I don't know, my doctor told me to take it. And I'll ask them if they have such and such, and they go, no. And I go, why are you taking the medicine? They go, I don't know, my doctor told me to. So it's a slippery slope in medicine. You got to be careful. Most people are smart enough now to quiz their doctors. You can go to the internet and learn a lot. I wouldn't just I go to doctors. I don't just take what they say on the surface. If I did, I'd already have my chest cracked, and my wrist would have been operated on, my elbow would have been operated on. I did have a shoulder surgery before I knew about regenerative medicine using PRP and platelets and stem cells. And I'm not going to say I was dumb, but I was dumb. I didn't know any better.
Well, you weren't dumb. You just were ignorant. You didn't know yet.
Yeah, I wasn't dumb. I was just ignorant.
Yeah, because you're not dumb. You're one of the smartest guys I know. Seriously.
Well, that's sweet of you, Nita. I think you're smart, too.
Thank you.
All right, so let's give out the phone number if you want to talk to me live right now. And thank you, other callers, for calling in. I appreciate that. Let's get some more callers at 866-870-5752. Grab your pen. I'm going to repeat it. If you're driving and you want to call in, please pull over to the side of the road. Get off your Bluetooth if you can so we can hear you. And it's 866-870-5752 to the studio live. And if you want to talk to someone at the office, if we didn't cover something you're interested in, just call the office.
Okay, let's say that number again, please.
Nita, I'm gonna. Come on, don't whip me too hard.
Come on. Let's do it again. 866-870-5752. Your turn.
Nita, you had coffee this morning, didn't you?
No, I didn't. Okay, here's my true confession. What did I have, Alec? Oh, half of a piece of... Oh, my gosh, it's time for a break. I'll have to tell you after the break. So
right,
you're listening to...
I was going to, Nita, say the number to my studio before you rudely cut me off.
Yes.
Actually, the number to the office, 800-300-9300.
And you're listening to Living Pain-Free with Dr. Marc Darrow. I'm Nita Valens, your host, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.